Earlier in this program, we explored the link between Maine's low birth rate and also a decline in healthcare options, particularly in rural parts of the state. But what's behind that, and why are fewer Maine residents choosing to have children? Today, we're speaking with a UMaine professor who studies this topic. Amy Blackstone is a professor of sociology based in Orono. In 2019, she wrote Child Free by Choice, the movement redefining family and creating a new age of independence. In the process, she spoke with numerous Maine residents who explained why they're not having kids.
The women I interviewed said, I know that even though my partner or my husband, even though we share the load of the household today, I know that if I had a kid, I would be doing the bulk of that work.
Blackstone says people choosing not to have children isn't a new phenomenon. What is changing is our willingness to talk openly about it. And while data shows Maine near the bottom of national birth rate rankings, there are numerous reasons for this, she says, and not all of them are bad. The rate of teen pregnancy at 8.4 is also among the nation's lowest.
We've done a really excellent job in Maine of lowering our teen pregnancy rates. Which in turn has lowered our overall fertility rates. And I think when people learn that, they're both surprised and I think generally happy. I think most of us would agree that it's a good thing that we've lowered our teen pregnancy rates.
But there are other factors contributing to Maine's low birth rate, according to Blackstone. These include a general worry about the state of the world, affordability, climate change, a lack of employer support, and the overall cost of raising children.
The world today is a scary place to live in. We have uncertainty in terms of the future economically. So people are telling us, people who are in their fertile years are telling us, I'm worried I won't be able to support children if I have them. I can barely pay my own rent and my own health insurance.
Blackstone says in Maine, there's also fear of isolation.
There just weren't good community supports for parents, particularly in the communities they were living in Maine, because they may be, living in a gorgeous house in the middle of nowhere that you can afford.
Blackstone believes there are solutions aside from pressuring people into parenthood, such as offering more convenient pathways to legal residency for migrants who want to settle here and creating a more welcoming environment for young people.
I get the angst and the anxiety around needing our population to continue to reproduce itself, but there are ways to do that avoid, again, pushing people who don't or aren't ready to become parents into doing it before they're ready. And I think that's really key.